Hello everyone. So today we are going to talk about analgesic and antipyretic drug. It is acetaminophen or paracetamol. So what is this drug? What is their importance and what is their side effect and how this drug act in our body? We will discuss everything in this lecture. So acetaminophen is commonly known as a paracetamol is one of the most commonly taken analgesic in the worldwide. And not only that, it is recommended as a first-line therapy and being conditioned by the World Health Organization. Acetaminophen is often misinterpreted as a NSAID or non-steroidal anti-inflammatory drug. This is because acetaminophen has some property like NSAID. For example, acetaminophen is antipyretic, mean it reduces fever. Acetaminophen is analgesic, it relieves pain, but it has lack the anti-inflammatory property, mean it doesn't reduce inflammation. It has also lacking the anticoagulative property, mean it doesn't reduce or prevent the blood clotting. Now, all these properties are commonly associated with this drug. That's why it is not considered an NSAID. So let's come to introduction. Class analgesic and antipyretic, as I have already explained. And one of the theory that is peroxide theory. Peroxide theory states that acetaminophen become inactive in the presence of peroxide. So peroxide is present in very large amount at the site of inflammation. That's why acetaminophen or paracetamol is lack the anti-inflammatory property. So peroxide theory or side theory. So that's why paracetamol is lacking the anti-inflammatory properties. Now come to nomenclature. There is two type naming nomenclature system for drug. Number first, generic name. For example, acetaminophen or paracetamol. Generic name is the common name of a drug. Or non-proprietary name like common name or common name of a drug. That is acetaminophen or paracetamol. And second is brand name or trade name. The name which is given by manufacturer, that is brand name or trade name, also called proprietary name. For example, Panadol and Calpol. Now come to dosage. Here two terms is used. One is dose and one is dosage. Dosage is the physical form of a drug like solid, gases and liquid. And dose is the amount of medication taken. Let's see right. So dosage form is the physical form of medicine and dose is the amount of medication taken. So Panadol is present in different dosage form like tablet, Panadol and Calpol. It also present in injectable form like Detamol and infusion form like Froas. So that is dosage of acetaminophen. Pen. Now come to mechanism of action. So mechanism of action Acetaminophen block COX-1 as well as COX-2. It blocks cyclooxygenase pathway, and some studies show that acetaminophen reversibly inhibit COX-3 in the central nervous system and decrease the production of prostaglandin. As a result, relieve pain. But how acetaminophen show antipyresis activities? So actually, acetaminophen cross blood-brain barrier, cross blood-brain barrier, and एक thermoregulatory center that is hypothalamus and show antipyresis activities. So now come to pharmacokinetic of acetaminophen. Pharmacokinetic mean absorption, distribution, metabolism, and excretion of drug. So first absorption. Acetaminophen will absorb the and as the absorption is related to the rate of gastric emptying. And peak blood concentration are usually reached within 30 to 60 minutes. 30 to 60 minutes. Now come to distribution. So acetaminophen uniformly distributed in the body at well distributed and slightly bound to plasma protein. 1 over 4 part is bound to plasma protein. That's why it distributed uniformly. Now come to metabolism. So a significant fast metabolism occurs in the luminal cell of intestine and hepatocyte. Now under normal circumstances, acetaminophen is conjugated in the liver and form glucocarbonated and sulfated metabolite. A portion of acetaminophen is hydroxylated and form an acetyl parabenzoquinone amine. So actually the metabolite is formed here and acetyl parabenzoquinone amine. Only 1% this metabolite is formed and 99% glucocarbonated and sulfated metabolite is formed. Now this N-acetyl parabenzoquinone amine is highly reactive and potentially dangerous substance. Now this high toxic substance and the setting of large toxic doses react with sulfate and hepatic cell protein and form a substance that causes the cell death and damage liver. On the other hand, under normal dose of acetaminophen, the N-acetyl parabenzoquinone amine react with sulfate group of glutathione and ultimately form non-toxic substance. So that's all about metabolism. Now come to pregnancy and lactation. So acetaminophen is generally considered safe during pregnancy and breastfeeding. The use of normal dose of acetaminophen during pregnancy is not associated with increase the risk of miscarriage or stillbirth. However, in case of maternal overdoses, spontaneous abortion can be seen. If we talk about lactation, so breastfeeding is generally considered safe, but usually this drug is excreted in milk. So if the infant relative dose is less than 10%, it is accepted. If the relative infant dose less than 10%, it is considered safe. If the relative infant dose is greater than 25%, breastfeeding must be avoided. In case of relative infant dose greater than 25%, breastfeeding must be avoided. Now come to dose. For adult, 400 gram to 500 milligram per day 4 times and not exceed 4 gram per day. 4 gram per day is avoided or not exceed. On other hand, in case of children, 10 to 15 milligram per kg for dose and not exceed 5 dose. Now come to hepatic impairment. In case of hepatic impairment, we should try to avoid as much as possible. If it is used, therapy should be limited and for short time and not exceed 2 gram per day. Onset of acetaminophen is 1 hour and half-life is 2 to 3 hours. In case of hepatic or liver disease, half-life may be increased to 4 hours. Excretion of acetaminophen. So acetaminophen is usually excreted in urine. So uses of acetaminophen. Acetaminophen is used in different conditions. Acetaminophen is most commonly used over-the-counter analgesic in case of headache, toothache, muscular pain, etc. It is also used as a peripheral analgesic in case of peptic ulcer, children, and bronchial asthma. It is used as a first choice analgesic in case of osteoarthritis. Let me write. So it is used as a OTC in case of headache, toothache, muscular pain, and menstrual period, etc. It is also used as a peripheral analgesic. So it is used as a peripheral analgesic in case of children, bronchial asthma, and peptic ulcer. It is used as a first choice analgesic in case of osteoarthritis. So these are the uses of acetaminophen. Now contraindication of acetaminophen. So it is contraindicated in case of hypersensitivity and active liver diseases.